Good afternoon, everyone, and welcome to the seventh annual JCB WIHV Lecture on Ethics and Governance of AI for Health. My name is Jennifer Gibson. I'm director of the Joint Center for Bioethics at the University of Toronto. We're delighted to host three spectacular scholars, Professor Barbara Prainsack from the University of Vienna, Professor Beth Coleman from the University of Toronto, and Professor Sophie Nunnally from the University of Ottawa to explore with us the topic of data solidarity, governing AI, what is data solidarity and why do we need it? Before we get started, though, I would like to take a moment to invite us all to open today's event in a good way by acknowledging this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. The mission of the Joint Center for Bioethics WIHV Lecture Series on Ethics and Governance of AI is to provoke discussion and to foster interdisciplinary engagement on the ethical, social, and political issues associated with the development and use of AI in health. The lecture began in 2018 with funding support of AMS Healthcare, and we continue to be grateful to AMS Healthcare for its continued partnership in exploring AI and the future of caring through the JCB's Ethics and AI for Good Health program and this annual lecture series. We are thrilled to co-host today's lecture with our partners, the Temerity Center for Research and Education in Medicine, TCARM at the University of Toronto, and the Institute for Education Research, TIER, at the University Health Network. So huge thanks to our partners, TCARM and TIER, for their collaboration in bringing today's event to life. Before I hand the proceedings over to today's moderator, Professor Jay Shaw, I'd like to share a few housekeeping items. The format of today's lecture is as follows. Dr. Prainsack will present for about 45 minutes, which will be followed by remarks from Dr. Coleman and Professor Nunnally, and an open panel discussion and Q&A with you, both in the room and online. We have quite a few people online joining us today, so we will be going back and forth between your conversation and discussion points and questions and those who are joining us online. During the Q&A, we will take questions from the room from both modalities. If you are online, we ask that you please put your question into the YouTube chat box or send your question via email to jcb.ea@utoronto.ca, and we will repeat these instructions before the Q&A begins. And in order for us to be able to field as many questions as possible from the audience, we ask that you please keep your questions brief so that we can field the questions both in the room and online, and giving a rich space for us to be able to explore the issues and topics. Finally, I should mention and underline that today's lecture is being recorded and will be posted on the TCARM website and the JCB's YouTube channel for future viewing. For those of you who are participating in person today during the Q&A session, your voice will be heard on the recording, but your image will not be visible. So thank you all for coming. I hope you enjoy the lecture and the discussion. Certainly, I'm looking forward to learning more about this topic, and so we'll be listening intently to both your questions and also the insight that we will gain from the scholars who are joining us today. But now I am pleased to invite Professor Jay Shaw, the JCB's Research Director of AI Ethics and Health, to introduce today's speakers and moderate the discussion. Jay, thank you.
Thank you, Jennifer. Thank you all for being here in attendance today. And of course, huge thanks to Professor Barbara Prainsack for the time and energy that you're spending here in Toronto with us today. So I won't make any sort of framing comments or anything. We'll look to Professor Prainsack for those. I just get the pleasure of introducing her. So Professor Prainsack is a full professor in the Department of Political Science at the University of Vienna, where she directs the Center for the Study of Contemporary Solidarity and the Interdisciplinary Research Platform in Governance of Digital Practices. Her work explores the social, ethical, and regulatory dimensions of genetic and data-driven practices and technologies in biomedicine and forensics. Her latest books are The Pandemic Within, Policymaking for a Better World with Professor Hank Wagenaar in 2021, and Personalized Medicine, Empowered Patients in the 21st Century from 2017. Barbara's involved in policy-related work as well, for example, as a member of the Austrian National Bioethics Commission and as chair of the European Group on Ethics in Science and New Technologies, which advises the European Commission. And this current academic year, 2023-2024, she's a fellow at the Institute of Advanced Study in Berlin, Germany. And without further ado, we'll invite Professor Prainsack.
Thank you very much. Can you hear and see? Sorry, can you hear and see me well? Wonderful. Thank you. I would like to join Jennifer and Jay by thanking the funders, everyone who made this possible. And I would like to thank in particular the Joint Center for Bioethics and Professors Jay Shaw and Jennifer Gibson for the introduction and for bringing me here to Toronto. And I'm very, very happy to be here. So as you know, I will talk about data solidarity and in the context of AI. Before that, I was asked, am I speaking into the microphone enough? Thank you. Thank you. So I was asked to also show you my potential conflict of interest. Jay kindly mentioned already the sort of advisory bodies that I'm a part of. I'm not speaking in this capacity, I'm speaking in a personal capacity. And I was also asked to include learning outcomes. So I hope to convince you that if you're not already convinced that we really need to see AI ethics and regulation as a political endeavor. I will also explain, of course, what I mean by this. I will make the case that how we're currently doing AI ethics is, or the dominant ways of doing AI ethics is not the right way. And we need to start with good data ethics. And then I will give a very, very brief overview of the research and policy advocacy program that I call Data Solidarity, and just give an overview of what it entails and how it could be used. And we will have time for discussing any questions, comments that you might have, and that will be very gratefully received. So to start, I would like to start with an example outside of healthcare. Who recognizes this image? Yeah. Exactly, yeah. So last summer, there were residents who placed traffic cones on self-driving cars, and because the cones interrupted the automatic systems of the cars, they brought them to sudden stops, and that led to kind of futuristic landscapes with metallic unicorns gracing traffic intersections. So it was the result of a concerted efforts of concerned citizens, and citizens were concerned about those self-driving cars. The concern was not just about road safety. It was about the spread of driverless cars that would replace the human drivers of ride-sharing services whose lives had been difficult enough. It's very, I think San Francisco is not known to have very much affordable housing and other affordable aspects about it. So the fact that the lives of the human drivers were becoming more difficult was what some people considered the result of policy making that really catered to the interests of big business and not the interests of people. And in this way, this protest in San Francisco became a symbol for the concerns of people, working people far beyond San Francisco, whose lives are becoming increasingly difficult due to rising costs. And the story of the traffic cone protest also shows how, to what extent artificial intelligence is really intertwined with virtually all aspects of contemporary life. Also in world regions where autonomous vehicles, generative AI, or AI-supported cancer care are out of reach for most people, AI-based technologies affect people's lives, either directly or indirectly. They shape the development or allocation of services and resources in virtually all of life's domains: labor, health, public administration, and in some countries also welfare. The perinatal care offered to a woman in rural Kenya, this is where the slide is from, may have been informed by data from maternity clinics in a neighboring country. An elderly person in Hungary may be using a symptom checker app that was trained on data from people in Canada. So one could say so much is changing. Generative AI has also brought awareness about AI and possible harms to the attention of many people who were not so concerned with it before. So one could say all of those issues are enough to explain why there's so much interest in AI ethics at the moment, right? There are people who even speak of an AI ethics bubble. And to show you, I'm not expecting you to read this, of course, but just to show the proliferation of ethics guidelines, this is a slide by colleagues at the Berkman Klein Center at Harvard. They show really how many AI ethics principles there are from civil society, government, from the private sector. The timeline starts in 2016. So this is just between 2016 and now. And if you go to their website, you will also see that the concerns that are voiced in the context of AI ethics, the principles that are written about, and that many, many guidelines about AI ethics all over the world are now considering. So we have a lot of AI ethics guidelines, but studies are showing that the impact of AI ethics guidelines so far has been close to zero. They just don't change practices on the ground. And this raises the question, and this is a serious question, it's a genuine question, not a rhetorical one. So what other functions do these guidelines fulfill? And one partial answer to this question lies in the fact, I argue, that these AI ethics initiatives, not all of them, but some of them, are pitting ethics against regulation. If the ethics is done right, so the argument goes, this was an argument that was made also in the context of the European Commission. Not the Commission made it, but one of the advisory bodies made it. If the ethics is done right, so the argument goes, then binding laws are not needed. Also, the notion of trustworthy AI, which is a term floated in the EU context and beyond, it does similar work by suggesting that if the technology is made trustworthy enough, then further regulation is unnecessary. And this pitting of ethics against regulation often comes along with the claim or the assumption that regulation stifles innovation. So there are two problems with this claim. There are probably more than two, but two that I highlight. First, regulation as such does not stifle innovation, of course. Ambiguous regulation does, overzealous regulation does. But regulation that gives clear guidance to developers what can and cannot be done does not stifle innovation at all, on the contrary. And scholars such as Keen Birch, Anna Atushina, and Margaret Ciabetta have shown that not all innovation in recent years, in decades actually, has helped to improve the lives of people. In fact, much of what we call innovation today has not helped to solve pressing social challenges at all. It has even made them worse. Think of deep fakes, the spread of fake news, or the escalating water and energy demands of generative AI, just to name a few. And if we are now tempted to think, okay, but at least, innovation keeps our economy going, that's not quite true either. I mean, some innovation obviously has fantastic benefits, but there's a lot of evidence. And again, Keen Birch, who's also in this room, and colleagues have done really, really important work on this to show that it has, much of what we call innovation has increased profits, capital gains, more than it has contributed to the real economy. It has increased social inequalities and societal ills that come with them. And this is also why more and more scholars are now drawing attention to what they call the dark side of innovation. And of course, this is not to say that innovation is bad, but I think we need tools to differentiate that between innovation that is worth fostering and supporting and innovation that might not create that much public value. So against this backdrop, the corporate quest to use ethics, to push back regulation, and to flood the field with ethics guidelines and scholarship that is directly or indirectly shaped by the interests of the tech industry is not a trivial development. So the tech industry is really, really investing heavily in the ethics domain. Endowed chairs, independent ethics advisors, and so on are coming up everywhere. And while industry funding for academic research as such is not new, the focus of corporate interest on ethics and regulation is relatively recent. At the same time as they're investing in ethics, tech corporations are also pushing deeper and deeper into areas of public expertise and public service provision. In the healthcare sector, this includes generous deals between public healthcare systems and for-profit enterprises, but it also means that public institutions increasingly rely on solutions owned and controlled by big tech. So this is just one example, and it might look wonderful at first sight, thinking, okay, the WHO is partnering with WhatsApp to get emergency messages to people. But if WhatsApp is the solution, then this amounts to nothing less really than a loss of democratic control over technology. Civil society actors such as independent media, but also state actors often have no realistic option but to use technologies owned or controlled by corporations that have legitimately, but still, they have very different interests in mind from protecting pluralistic debate and democracy. Public actors are losing expertise and control over the tools that they need to do their jobs. And the WHO teaming up with WhatsApp to get emergency advice to citizens is only one example. So to address this problem, I think we need a political understanding of ethics. This is not to say that ethics should be partisan or serve particularistic interests, of course, but it's really about asking the big and difficult questions about what kind of innovation we want and at whose cost. Most importantly, it's one that asks how we can gain and retain democratic control over the development and deployment of technologies. The all affected interests principle, as political theorists will know, refers to the idea that in democracies, people should have an opportunity to influence decisions that concern important aspects of their lives. When it comes to technology development and deployment, they regularly do not. And what doesn't help here are ethics guidelines that try to make big players behave a little bit more ethically, but leave the rest of the political economy as it is. We need an ethics here that asks what kind of society we want to live in, and that helps policymakers to follow up on the answers to this question. And the role of academics and other professionals in this process is, among other things, to ensure that we frame the problems correctly. So as I'm sure there are many policy experts in this room, the way that we frame a problem shapes the answers we give. It shapes the instruments we pick to solve it. To give an example from the non-AI domain, if we frame vaccine hesitancy as an information deficit problem, the solution will be more information. As is known, this has not solved the problem. If we frame it as a problem of people articulating distrust or discontent with political leaderships, then the solution will be to make people feel heard and actually listen to them. So the framing of a question is really the first important step to a good framework and to good governance in this case. So what then is the question that AI ethics and regulation should answer? First of all, the problems that were created through policies and by other human practices require a political and a social solution and not just a technological fix. Here, the problem definitions and solutions that assume that machines can fully replace human beings should be viewed with caution. As early in the 1980s, and I believe that many in this room will be familiar with this paper, the psychologist Lisanne Bainbridge diagnosed two common misconceptions around automation that we still find in societal and also in some regulatory discussions on AI today. The first is the assumption that humans and not machines are the main source of error. So we encounter this in a lot of medical domains where AI is proposed exactly as a solution for this problem. And I'm not saying that we shouldn't use AI to help detect skin cancer. Obviously we should, but it means that technology cannot be the only solution. It's not only because AI is not free from human error either, for reasons that are well known to this audience. It's also because, and this is the second misconception that Bainbridge mentions, it's because most processes cannot be fully automated. What you can fully automate, as you know, are processes that are routine and predictable. Obviously, AI is fantastic in discovering patterns, sifting through data sets without ever getting tired. But human experience and human labor are needed to correct the design mistakes that automation makes when one lives under the assumption that we can fully automate complex processes. Even in the context of tasks where machines outperform humans, there's always some stuff around these processes for which humans are needed. So high-tech solutions cannot come at the cost of high touch, especially not in healthcare. And when politicians suggest technology fixes for complex social problems, such as labor shortages in healthcare, this is often to conceal a reluctance to improve pay and working conditions. In some cases, the tech fix approach also justifies the divestment from education and training, often under the guise of austerity. We need to save money, right? And this is a fantastic slide that I just came across recently. This was the then Health Secretary, Jeremy Hunt, back in 2015. It was at a time when the Tory government really came down very hard on junior doctors. They changed the working conditions for junior doctors, so much so that even other Tories thought it was a bit extreme, because we need doctors, right? But Jeremy Hunt thought that there won't be so many doctors that are needed because AI will do the job. That he seemed to have referred to Theranos is an irony of history. But the assumption that AI can be a solution to the labor shortage in healthcare is that if machines can do the job, why invest in people? And we all know, everyone who has anything to do with the healthcare sector, that that's very problematic and fateful assumption. But some of the dystopic predictions should also be received with caution. Stoking the fear of AI stealing millions of jobs worldwide, as many business consultancies do, with a message being repeated by public media and also by some academics, keeps the fear of unemployment alive in times when unemployment is low and the balance of power is shifting in favor of workers. The specter of AI comes in handy. People who are afraid of mass unemployment are not very likely to make a lot of demands. So This means that most of the ethical challenges that dominate public debates about AI at the moment are, I argue, not the ones that are the most pressing. Few technologies completely replace human labor. What is much more common is that they change work processes and job profiles in ways that are hard to predict. Working in healthcare in the future will mean working more with machines and using different skills than in the past. So questions that we should be concerned with are, what about those people who will be replaced and who don't have the skills that are required to remain competitive in the market? What about those who won't be replaced, but whose salaries are not enough to make a living? And how can we ensure that the time that the use of AI frees up will not immediately be filled up with administrative and other tasks? I think this is a very instructive slide. So the housewives at the time were promised that the machines to launder their laundry would save them a lot of time, and we know how that ended, right? And this is, of course, the story of a lot of technology use in many professions where the time that is freed up it doesn't benefit the working people, but it benefits someone else. So how can we ensure that healthcare workers will be able to spend their time on things that really matter? And for many, those were the reasons that for them to choose this career in the first place: interacting with patients and families, keeping up with the state of the art, and also having time to rest so that they're not constantly on the verge of burnout. These are questions that we should worry about. And in fact, one of the key ethical challenges around AI technologies is that AI, as many other technologies, are used in such a way that they increase existing inequalities. Instead of ensuring that the productivity gains from the deployment of AI lifts all boats, financial profits have so far primarily benefited entrepreneurs and shareholders. So the ethics of AI, this has been my point so far, cannot be ignorant of politics if it wants to be relevant, if it wants to avoid that it keeps having zero impact on practice. AI principles that ignore the political economy are inevitably ineffective. And this leaves us with one question as a foundation for all others: how can we create conditions for a society in which AI cannot do so much harm, and where it's easier and safer to reap its benefits? So this is where I will argue that the first and perhaps the key question, the key thing to get right, is how we think about and regulate data. And here we have a real problem. The problem is that the categories and the tools that society almost all over the world use to classify and regulate data are from the paper age. We treat data as if they were something that is stored on a piece of paper that can be locked away in a drawer or burned or otherwise destroyed. But in the digital era, as we all know, many of those things have changed. Digital data are multiple. They're in several places at the same time. They're routinely linked across domains, often in ways that are untraceable, and they are continuously interrogated. So this idea of consenting to data use comes, of course, from the paper age. It comes from bioethics, where the patient was asked, "Can I take out your appendix?" But data used is not bounded in the same way as a medical intervention. So this is to illustrate that part of the problem is, of course, that some of the ethical instruments are not only from the paper age, but also from medicine, where the inevitable differences between the physical body and the data body create all kinds of problems. So digital data are also relational in much deeper ways than in the paper age. Not only do they emerge out of relations between different entities and disclose information about more than one person, but practices such as predictive analytics have also turned the relationality of data into a business model. The data from one group is used to make inferences about another. In the ongoing debates about inferred data and also synthetic data, these debates illustrate this. And the failure of recognizing a key ingredient or a key feature of data in the digital age, namely relationality, also explains why so many people were so surprised by what generative AI is doing. Had we had different categories to think about data, we wouldn't have been so surprised collectively. So this is not merely an academic issue. It does create tangible harms in some places. To give you another example, one distinction that marks virtually all legal systems around the world is that between personal and non-personal data. In Canada, in the EU, and in many other places, personal data are those that relate to an identified or identifiable individual, and it's mostly these data that are protected. GDPR, the General Data Protection Regulation, doesn't even apply to data that are not personal. But again, this is from the paper age, because the differentiation between personal and non-personal data fails to consider in the digital era the stakes that people have in data that are not technically personal, in the sense that they are not linked to them as an identified or identifiable individual. So for example, when an organization makes inferences from data of Ali, Bernadette, and Conrad regarding the likely characteristics of Dina, and declines Dina an insurance or service claim, then Dina has typically no redress unless it was an obvious case of discrimination, because most data regimes protect only primary data subjects. This is a problem that Mark Taylor called attention to over 10 years ago in the context of genetic data. Another problem is the strong emphasis that regulatory frameworks around the world place on data types. They assume that some types of data, such as health data, require stricter protections than other types of data. I mean, clearly health data need to be protected, but in the era of almost unlimited potentials for data linkage, the boundaries between different data types have become very blurry. It's possible to infer health-related information about specific individuals from almost any kind of data, however innocuous. So think of the finding that men who skip breakfast have a higher risk of heart disease, or that areas with more Uber rides have higher levels of crime on average. I'm not sure that the latter is still the case, but these results made headlines in the 2010s. It doesn't matter whether the phenomena in question are causally related. This is a kind of answer that I often get, to say, yeah, these are correlations, but it doesn't matter. To be actionable, the association is enough. It's enough for insurances, it's enough for other entities, also for governments. Think of the robo-debt scandal in Australia, the child support crisis in the Netherlands, which at least it brought down the government in the Netherlands. It's not data types, but certain kinds of data use that are more or less likely to cause harm. So the collective inability to view and discuss digital data in ways that are appropriate to the digital era leaves our societies unable to fully harness the benefits of digital practices and also to protect people from harm. So rather than using ever more legal and ethical instruments from the same regulatory toolbox, we need a new toolbox. And this is where data solidarity enters. So the lack of aesthetics of this slide does not correspond with the incredible excitement that I have for this concept, and I think that it deserves. Data solidarity is not an instrument. It's really a new way of thinking, a different way of thinking about what data are and how we should regulate them. So it recognizes that digital data can create a lot of benefits, but also that these benefits and the risks are currently distributed very inequitably across the globe. So there's a global equity problem, but also within societies. And that's what data solidarity tries to change. So it consists of 3 pillars. The first pillar tries to facilitate data use that has a lot of public value. Please bear with me for 1 minute. I will say more about what public value is and how it can be operationalized. So when data use has a lot of public value, let's make it easier. This can mean to remove red tape around it, to exempt this type of data use from some requirements. Of course, the limit is always personal rights and freedoms, which data solidarity does not want to touch or do away with. But let's make it easier. And let's maybe also fund it. Finland has an instrument. It's not perfect, but at least it embodies the idea that if somebody has a very, very good idea for data use that is likely to create a lot of public value and doesn't have the time or money to get all the permits, to get everything together, then maybe there's an agency there that helps them to do that. The second pillar is about harm prevention and harm mitigation, meaning that if we know that some data uses they have risk, they have significant risks for communities, for individuals, and they're not going to create public value, they're very unlikely to create any public value, let's prohibit it. Just because some people can make money with it, that's not good enough if we have these high risks and low benefits. So surveillance advertising would be an example. And also in the context where harm prevention has not managed to really prevent harm, and some harms will still occur, we need to make sure that people who have been harmed have easy access to help, which is not currently the case. I could say much more about this. I won't do it in the interest of time, but I'm very happy to discuss this later on if anyone has comments or questions on this. So because it's so difficult nowadays to trace data and to actually pinpoint what caused the harm, many people are left without any remedies to data harms. And the third pillar is to, in cases where we have data use that has very little public value, but it also doesn't pose significant harms, it mostly creates commercial profits, fine, but share the profits with the public. More of those profits needs to come back to the people that created the data, because data is not oil. It's not something that a company takes out of the ground and then they have a claim to use it. Data ultimately always comes from people, from communities, from public infrastructures. So some of those profits need to come back. So data solidarity, to summarize this, recognizes that people are regularly willing to share their data, even if they will not benefit personally. This is what empirical research shows. As long as insights from this data and results from this data will not be used against them, and as long as other people benefit and not only companies. Empirical research from all over the world has shown this. So how do we get to such a better way of governing data? How can we support data users that do good things, meaning that they help people and communities without putting individuals or group at risk? So within the data solidarity framework, the notion of public value that does this work. Data use is seen as having public value when it can, this is just reading from the slide here, when it can be plausibly assumed that it will have clear benefits either for many people, for society as a whole, or for future generations, and at the same time, that no person or group is likely to experience significant and undue harm. And public value is regularly more pronounced if the benefits are likely to materialize for underserved or marginalized groups. So if you think this is very abstract, you're absolutely right. This is why we have tried to operationalize this. Our data solidarity team in Vienna has developed an online tool that supports a structured assessment of the public value of data use by weighting the risks and benefits. Depending on the relationship between public benefits and risks for individuals and communities, data solidarity then differentiates between 4 types of data use. But just let me show you what the tool looks like. It can be accessed online. When you've answered the 22 questions, you can do this as a data user, but you can also do this as a citizen, as a patient. You will get a result with counterfactuals on the side saying your public value score would be better if, for example, the data using organization complied better with information requests regarding data use, and so on. So the counterfactuals serve as an indication for data users to improve their public value score if they want to do this. I have nothing on screen anymore. Oh, it's back. So, and then you get a result in one of those quadrants, and the quadrants, they really represent 4 different types of data use. The type A is data use that is likely to create a lot of public benefits and has very low risks, so that should be made easier. On the opposite end, D is the bad type, high risks, low benefits, that should be prohibited. In the middle, you have high risks, high benefits, that the risks need to go down. And then you also have a type that says low risks, low benefits, fine, but if there are commercial profits, share the profits. That's in a nutshell, this is what the model says. So this, I argue, provides a viable or feasible framework for enhancing democratic control over digital practices, and also realizes a more equitable distribution of the harms and benefits from them. So if, for example, legal consequences or regulatory consequences were tied to the different types of data use, if we said, for example, if something creates high public value, it will be exempt from some rules, it will even get public funding. If we really had a commitment to prohibit type D, the ones that we know harm people, and they're just out there for some people to make a few bucks, then we would already have a more, I'm not saying all problems will be solved, but we would already have a more equitable distribution of benefits and risks. Data solidarity also gets us out of a very unproductive, myopic focus only on individual control. We know that individual control cannot solve all the problems. And it also debunks the myth that individual rights protection are always in tension with the public good. It's not a zero-sum game. Very often the two are aligned. There are areas where they're in a tension, but good data protection, respect for privacy, and an attempt to increase public value is in the interest of individuals and in the interest of collectives. So data solidarity acknowledges that people, rather than standing in opposition to each other, often stand in opposition to the profit-making of a few. So to get to a conclusion, I started my talk with a spotlight on the protest in San Francisco last summer when citizens protested political decisions that enabled the rapid spread of autonomous vehicles, putting the livelihoods of human drivers at risk. It showed the extent to which digital technologies and also the practices subsumed under AI in particular are woven into processes and practices that articulate the current political economy. And rather than treating ethical and regulatory issues related to AI as separate from the political and economic institutions of our society, ethics and governance must be considered in the context of those institutions. We shouldn't let the owners and CEOs of tech giants and business consultancies who warn of existential risks, such as mass unemployment or the end of humanity, distract us from the much more mundane ways in which digital technologies pose problems for people and obviously also create benefits that are distributed unequally. By contributing to the intensification of work, increasing workplace surveillance, crowding human touch out of healthcare, and in general, increasing inequalities and inequities within and across societies, digital technologies and AI is getting a bad name, and it actually shouldn't get a bad name. I've also argued against AI exceptionalism in the sense that the practices subsumed under AI are treated as different from other digital practices. I think they should not. So I'm not so sure we need AI principles. Maybe we need digital data use principles, but please disagree with me. I would love to hear if you do. I think considerations about the ethics and governance of AI should start with getting the ethics and governance of data rights, including also data generation. So this is something that I haven't discussed here today, but it is also a very, very important question. Current governance frameworks assume that the problems start when the data are there. but we need to have many, many more discussions about questions about what parts of our bodies and lives we datafy in the first place, right? This is where it has to start. And data solidarity, I have argued, is an approach, it's one way to do this. It tries to achieve a more equitable distribution of the benefits and harms emerging from digital practices. It does not mean or call for more regulation, it calls for different regulation. It changes the way we think about data in three significant ways, I argue. First of all, we're shifting our thinking from thinking in terms of data types to data users. Actually, some regulatory bodies do that now. One could argue that the EU Commission does this to some extent. I'm sure this also applies to Canada. There's also no binary assessment anymore of whether something is in the public interest or not. We know that these public interest assessments have really enabled companies to argue that, powerful companies, to argue that everything they do is in the public interest, whereas smaller entities, charities, smaller companies have not been able to do that. So it moves the public interest assessment to a much more messy, democratic, deliberative discussion about what public value is. And we also no longer rely on outdated ways of classifying data, personal, non-personal, human, non-human. I think all these binaries coming from the paper age should be thrown out. So data solidarity requires that data use that poses high risk should be outlawed. This prohibition should be effectively enforced, and data uses that create a lot of public value should be proactively supported. And this, the overall purpose of this, is to increase democratic control, not only over digital data, but also digital infrastructures ultimately. If we get these things right, then we will have created societies where the use of AI poses far smaller risks than it's currently the case. And what needs to be part of this is also public investment and a public recognition, a recognition by public bodies that digital infrastructures are critical infrastructures that require democratic control. They're not a neutral substrate for services that are exchanged on top of them. We also, and this is just a spotlight at the very end, because this paper has just come out last week, we also need to move away from a purely risk-based thinking about AI. So again, here, data solidarity, this is an argument that we're making here, can help us to bring in the benefits and the risks into the equation with our eyes on public value. So I'll stop here. Thank you very much for listening, and I look forward to comments, and I look forward to the discussion.
Check. Hello. It's on. Good. Good. Working. Okay. Well, thank you so much, Barbara, for that. Just very sophisticated take on a very complex issue. I think you've illustrated how so many teams come together very nicely. So thank you. I'll now just take a moment to introduce our respondents, and I've just somewhat abbreviated introductions so that we can spend a bit more time speaking. But first, we have Sophie Nunnery, who's the Associate Director of the University of Ottawa Center for Health Law, Policy, and Ethics. She works on issues related to mental health law, legal capacity and decision-making, and the regulation of health-related artificial intelligence. And she holds a 2023-2024 fellowship in compassion and artificial intelligence from AMS Healthcare, examining human rights implications of mental health AI. And to her left, we have Professor Beth Coleman, Associate Professor of Data and Cities at the Institute of Communication, Culture, Information, and Technology, and the Faculty of Information here at the University of Toronto. And is also Research Lead for AI Policy and Praxis at the Schwartz-Wiesman Institute for Technology and Society. And her work in science and technology studies, media and cultural studies, and critical race theory explores how advanced automation shapes societies, communication, and social dynamics. So in alphabetical order, we'll ask Beth, please, to share a few comments first, and then we'll move to Sophie. Thank you, Sophie. Yes, please.
Yeah, I think, yeah. Barbara, thank you so much. Some of the granularity of the baseline of data solidarity, I agree with very strongly when they said, I said, paper, and I said, okay, this makes a lot of sense. It makes sense, and that people are working on this with different names across different sectors. It's quite powerful that this is emerging. So of course, practically speaking, some of the issues that we run into are a combination of the history of regulation, specifically things around individual versus an idea of public good. But there's also some things that are quite impactful in terms of having practice. So when we look to, let's say, here in Toronto and in Ontario, if we try to say, well, the shelters will benefit getting information from the hospitals are provincially governed and have more data and have different kinds of modes of interpreting regulation as opposed to municipal. It's quite difficult, even though it's the same governance structure, to have people have trustworthy data. So that's just one instance of where we are right now, and then also the political will and the resources to actually shift both regulation and infrastructure to how it's. The other example that I bring up in terms of where we're located at the moment, I came to the University of Toronto with Data Cities when Sidewalk Labs, a Google company, had been given the keys to the city, a handshake from the Prime Minister, and so they come and make this into this wonderland of IoT, Internet of Things. So Internet of Things, which is a type of advanced automation. It's not at the same scale of what we're calling artificial intelligence. But again, it is a very good time to step back and ask, what are the AIs? They're not all the same. And the way generative AI works is different than reinforcement learning. We have models that are very specifically designed for certain kinds of particularly scientific inquiry. So protein folding is a very famous example at this point. It's narrow and it's rigorous, and it's also testable in terms of traditional scientific method. What we have with generative AI is, to a certain extent, just something to play with. And that it has taken so much public attention and that it costs environmentally so much to actually just run is, I would say, bewildering, but it's not. It seems strategic. So I guess those are my reflections in terms of agreeing on the motivations and creating better connections between ethics and regulation. The idea that a system is trustworthy so that it doesn't need to be regulated is, I think, exactly what OpenAI would like us to agree to. But an ongoing problem that you point to in terms of a much longer history of datafication and what was called at a certain moment big data, which literally is the engine that drives the technologies that we're seeing in front of us today. So much of that was modeled on a services and user framework not one of public good and not one of civic engagement. And it's incredibly challenging to reorganize that. I mean, the examples that I gave were, a private company coming into public sector, and then, hospitals and city services. We're not even touching a company like Anthropic or OpenAI, which are not publicly traded. We have no way of touching that. That Anthropic has started to publicize certain layers of transparency in terms of, this is what's going on with our model. Here's some data about how it's trained. That's something about how they're positioning themselves. Anyway, I said I was done, so let me be done.
Thanks, Beth. Yeah, Sophie, on to you, please. Thank you.
Okay, thanks so much, and thanks for the invitation to be here. And I was so pleased to hear your talk and have lots of thoughts about it. It's such an interesting framework. I think there are a couple themes in particular that I think really struck me as relevant. So my head goes to regulation and law. And I think the point about the loss, the loss of democratic control over technology is really, really important, and one I think about a lot in the context of the development that we're seeing in so many jurisdictions right now of AI regulation. So in Canada, we have the proposed AI and Data Act. There's the EU AI legislation, AI Act, and I think a real concern is whether, who's at the table in these conversations, who are the voices that are heard in the creation of the rules and the regulations. And so I'll just refer to a little bit of the work that I think might be interesting to this crowd that some of my colleagues and I are doing, which is a review of the literature talking about legal issues with health AI and looking at the disciplinary differences. So we're looking at how do lawyers talk about legal issues with health AI? How do doctors talk about it? How do the engineers and people in computer science talk about it? And we're seeing really important, I think important disciplinary gaps and differences. So for example, I think relevant to your research is that a preliminary finding is that the computer scientists and engineers aren't really talking at all about legal risk and solutions. It's just not in the published literature. Another concerning finding, I think, is that there isn't a lot of literature from low and middle income countries where issues of algorithmic bias are potentially really, really troubling. And then another sort of gap that I think about a lot is I've been having conversations with some patient partner organizations, and they're really frustrated about the difficulty of breaking into these conversations about AI regulation. How do those voices get before governments? And so I think in Canada, and I imagine it's similar elsewhere, governments have been quite good at making sure that industry is there at the table because of this concern for incorporating those voices and not stifling innovation. And that is important, but it's certainly not enough. And I think some of the early criticisms of the legislation in Canada were that, why is the legislation housed under a minister whose mandate is to foster innovation as opposed to a more holistic one. These are all, I think, really important things that we want to think about, because not just is that an issue in terms of a problem, a democratic problem, a democracy problem, but it's also relevant to getting it right. We have very different opinions across stakeholders, across disciplines as to what is a risk, what is benefit, and how do we trade them off when there's those inevitable conflicts. The other theme that I think really was interesting to me that stood out is the one, again, I have to look at my notes, what you said, a political understanding of ethics. And I like the way you put it. You said we need to be asking big and difficult questions about what kind of innovation we want and at whose costs. And so, as Jay said at the outset, I do work in mental health. And there's an area where there are huge philosophical differences as to what is health, what is disability, what does care look like. And we also know there are enormous gaps in mental health service provision. So many people just don't have access to anything. And so AI, wonderful, it's going to step in and fill that gap. I think there's a lot of understandable and justifiable enthusiasm, but also there's a concern. Are we going to push those debates to the side and not worry anymore about properly funding mental health care and say, well, people have these apps they can download and we're going to individualize responsibility for mental health care? That worries me, especially if there's insufficient regulation of those tools. I've read some research suggesting that the number of apps that actually meet clinical guidelines is pretty low. So there's an example, I think, of where there's a concern that maybe Frank Pasquale writes in this area, and he uses the term putting a thumb on the scale. Is AI going to push us in this direction? The AI leading the policy as opposed to the policy leading the AI. So those are the two things that really struck me. I guess I had a couple questions about your approach, and I think you touched on one of the possible answers at the end of your talk, but I wondered whether the current regulatory efforts, so in the EU, you mentioned it's now, there's legislation that will regulate AI according to the level of risk, so categories of risk. And in Canada, likewise, it's phrased a little bit differently, but it's high impact AI that is proposed to be regulated. So is this kind of approach consistent that seems to be speaking about the use and effect of data use? Is that a step in the right direction? Are we moving towards potentially a data solidarity approach? And I guess my last question, I don't know if it's maybe you answered it, but I do wonder if there's a tension, I guess, remaining between a solidarity approach that's really, you talk about collective control of data. Is there a concern sometimes that it might be inconsistent with an individual rights approach? Certainly lots of critiques of rights analysis as being too individual, but sometimes those two columns you had on your slide, column 1 and column 2, they're not always in conflict, but sometimes they are. Sometimes the will of the collective is oppressive. So is there a role still in place within your schema for those more traditional individual human rights protections?
Should I respond right away?
Yes, please, go ahead.
So thank you very much to both of you. I will start with the, not working? It's on? Yeah, okay, it's on. I'll speak louder, sorry. I'll start with the last questions because they were very specific. So when it comes to individual rights, I don't see any way in which data solidarity would compromise that. So the collective, the layer of collective control is something that comes on top of existing individual rights protection, but there's no situation where we would say that whatever we consider public value trumps individual rights. So this is what I meant by the unproductive dichotomies. Very often they are aligned, and where they are in a tension, then typically individual rights protections would trump the public value assessment, because you would still need to consent, for example, for the data to be used. Even if somebody says the data use creates a lot of public value, you would still have to consent. So data solidarity does not hollow out current individual rights protection. Having said that, it could be that going forward, that if regulation thought that this is a very good approach, that the conclusion would be that in the very, very low risk context, where the potential benefits are very high, no additional individual level protection and control rights are being mandated. Going forward, that could be. But overall, data solidarity approach wants to acknowledge that individual rights and public value, I'm not saying the collective good, I'm not using this term. The public value and individual rights are sometimes usually are often compatible, and where they're not compatible, individual rights protection as it's legislated at the moment will remain in place. So it's an additional layer. What I will also say is that I believe that so far the myopic focus on individual rights, not individual rights, but I should put it differently. The idea that individual level control will prevent harm has been an impediment to see that sometimes collective action is needed. So if you isolate the relationship between the data user and the data subject, if you assume that if I give Meta my consent to use the data, that is a kind of false balance. It's a contractual relationship between two extremely unequal partners. So again, please don't misunderstand me. I'm not saying, and therefore we don't need individual consent. I think the idea that individual consent will do all the work, that's the problem. It's not a problem that we have individual control. Whether it is, and especially in the health domain, this will remain necessary. I can think of examples around environmental data, where I think community rights are more important than individual rights. So that the community decides what happens with data about the mountain, about the forest. I don't necessarily need to have individual level control over the weather data in my area, but the community should. But in the health domain, individual control remains very important, I think. And again, the public value assessment doesn't hollow that out. This is also why we use this term public value, because we wanted to break with the tradition of the common good or the public good, which has a very strong connotation of the dominant population saying this is the right thing, this is good. So that's why we're not using this term. I know that public value also has some problems, especially in public administration, but we discuss that. What we mean by, sorry, I'm going on for too long. The EU, I think the EU Commission is not going in the direction of data solidarity at the moment. I hope they will, but they're not. So this whole notion of altruistic organizations is, many developments around the European health data space are going in the other direction. They do put more emphasis on data use, but they have this idea that, you know, there are some organizations, everything they do is good, others are everything they do is difficult or problematic, and they black box the idea of what public value is. And what we want to do with this tool also is to open up the discussion. The public value assessment tool is not a tool that says, we're telling you what public value is. The tool has very detailed explanations of why we chose the questions, how we weight the answers, so that everyone who wants to use the tool can say, we built the tool differently. We don't agree with your weighting score. We want to have other questions. For us, it's more about future generations, because we work on environmental context. So we want people to use that. And this also speaks to the question of who says what public value is, what risks and what benefits should matter. I think there's some lines that we can draw. We can say, if something has a history of creating harms, it's bad, right? We don't need to have a discussion on this. But most data use cases are in an area where it depends on the practices, on the communities, and so on. And so the public value assessment leaves that open. It gives people the opportunity to say, we are adjusting that assessment to fit the needs of this community, or to meet the needs of a national framework for something. But it tries to at least bring it out into the open and make people discuss about public value, and not say, is it in the public interest, yes or no? And some experts assess that. So, and that's also speaking to what you said, Beth. Of course, it's difficult and uncomfortable. I think many of the examples that you have given remind me of how difficult the path will be, because the cards are stacked against us. And exactly as you say, What OpenAI wants us to do is to accept these labels of trustworthy AI, and data ethics is so important, and then regulation is not needed because regulation stifles innovation. We constantly have to push back against this, I think, and still we might lose at the end. But at least we need to try, I think.
Thank you for the responses, and Barbara, for your reflections in response again. I think just given the time, we'd like to open up to the audience for some questions, and the questions can be targeted to any of our speakers. We'll be taking questions both online and in the room, so we'll start in the room. There is a roaming microphone that will be going around to be able to take questions. Thanks, Tukmani. I see you have that there. And Remzi, maybe I'll ask you to come up if any questions do come up. I'll just look to you for the online. And I see we have a first question at the back. Thanks. So please, we do have time just for a couple of questions. So maybe I'll take two at a time. We can field some responses.
My name is Alexey. I'm a software developer. I've got a question for Professor Prainsack. Briefly, my question is, do we have any kind of success history to encourage us on this journey? See, it's not the first time that technologies are crushing our jobs and change our lives. Trivial example like coachmen, laundresses, switchboard operators. Those jobs are gone. They're gone forever. They're gone without any trace, regardless of how considerate we as a society could possibly have been at the time. And our society today is shaped without any traceable relation to what we could discuss about public value back then. So question is, do we have any examples of success in addressing those issues?
Thank you. And we'll take a second question as well in the second row here. Thank you.
Hi. Okay. Thank you all. I'm Shira. I'm a grad student actually at McGill, so I'm here from Montreal. I had a question that's kind of related actually, which is I feel that a lot of these conversations happen in hypotheticals, like, oh, hypothetically, AI could destroy the world, or, I think a rebuttal to, well, AI is causing harms now is, well, what if AI could cure cancer or some kind of wildly imaginative potential good? So I guess my question is how to concretize the discussion, especially of public benefit, because I think it's easier to concretize the discussion of harm than maybe benefit, but I could be wrong about that too.
Thanks. So let's have Barbara respond, and then Sophie and Beth, if there's more.
Thank you. Concretizing benefits, especially in the health domain, I think we can do that. What comes to mind is, for example, the use of AI in drug development, also in contexts where with imaging, for example, where it could, in theory, free up the time of human experts to do things that matter. The problem is, again, that the time that AI has freed up for radiologists is often not filled with things that they would want to do and that they should do, but just with more, they just read more images now. So I think that's the problem. But those would be benefits that I would consider benefits. But I agree that it's very important to break these discussions down to concrete things and say, what are the examples? So that's what we did in the tool, what we tried to do in the tool. Are there examples for successes of addressing those issues? I think no. I don't think we have good examples of successes. So there are, of course, the tech optimists who say that AI will create more, or automation in the widest sense creates more jobs than it destroys. The online yoga teacher didn't exist even 10 years ago. There are the tech pessimists who say it will destroy more jobs than it creates, because in the past people could also go into new areas and look for jobs elsewhere, and we know that this is very often not the case today. But I think everyone, the optimists and the pessimists, agree that there are people who temporarily will be replaced. They will not have the skills that are needed. And we're just leaving those people by their own devices. We're not really having any, by we, I mean the policymakers. I don't see any good strategies to support those people. I don't see any country implementing universal basic income, which would be a good approach, I think, to enable people to really retrain and do what they want to do. So the short answer is no. I don't think we have examples, but I would love to hear if anyone thinks we do.
Sophie? So examples of benefits of AI. I mean, I think there are lots of examples. I think maybe I'm more of an optimist, but I guess it depends on how broadly you want to cast your lens. So there's a question, the immediate question of whether an AI use is resulting in better health outcomes. And then there's the broader questions of how that ripples out into the workforce and society. But and that's a more difficult question to answer. But on the narrow question, I mean, there are lots of, where I work, we've been doing case studies looking at the legal and ethical implications of particular health AI technologies. And there are lots of them, and they are starting to be rolled out. I mean, here in Toronto, there's some people at CeSCoS Hospital, for example, Devin Singh and Anna Goldenberg are two of them who are doing really interesting work looking at things like how can you, a kid comes into the ER and how do you triage and get them more quickly to the test they need and bypass, the different levels of people in screening they have to go through, and therefore slow down the treatment process. And it seems to be yielding, I think it's only in the test phases, but some pretty promising results. So I do think that there's reason for optimism from where I sit. It's not all roses, but I think, yeah, we need to take those kinds of technological tools and then figure out how they fit within those broader political questions about what we want healthcare to look like, and labor and employment. And as I say, those are more challenging.
So Beth Novak, who does a lot of work on maybe I'll call it public value and civic engagement, she brought this up in looking at when you want a public consultation, which are notoriously rigged. We're going to go build this high rise. We're going to go do this thing, and we're asking for public consultation. And people show up, they say something, it gets written down someplace, and nothing ever happens. And what she recommended is perhaps a helpful thing that we can use for AI in terms of pattern finding, being able to take a lot of noise and channel it into something that looks like something legible, organize it, is maybe it could weirdly, even though I just said they're toys, could be used in kind of democratic process. We have so much noise going on, and we do need more ways to organize how to hear better. And the idea of data trust has been circling for a few years now. Pre-COVID, people were trying to wrangle, how can we do this better? Because we cannot possibly do it as individuals. We cannot give consent every day in that way. It's already a hassle getting the extra push when you're trying to get onto your courseware. I mean, you guys live with this every day. That's not even what data trust is. So thinking about these models and then the tools of communication, and I guess in some ways, the question of the loss of jobs, it's helpful that AI has accelerated that as a conversation, because we already were careening toward an absolute paradigm shift in terms of who works and what that labor looks like. And that AI systems in relationship to robotics, there's a way in which the automation has a materialized physical reach, and that's been put into practice in factories for sure. I don't know about to what extent in hospitals. So I would say that there are some ways in which, I mean, in the same way, these tools are already being used to, kill democracy in the important international elections that are going on now and will continue over the next year. I think, this isn't really fair, but a follow-up question I have for Barbara is, in calling for data solidarity, is that a universal call? Or is it data solidarity like in Finland and Estonia, but not in India, even though some of the same technologies exist, but the relationships, as you pointed out, in terms of, frankly, power relationships are quite varied.
Thanks. I think what we'll do, we're running down to the final minutes, so maybe let's take one online question, and then we'll give final remarks to Barbara, and she can respond to that question as well, Beth. So Remzieh, could you share?
So there's only one question. It's about hospitals and health service providers are often large, bureaucratic, and complex organizations with their own complex governance structures. What is needed to operationalize new data governance structures in these organizations so they can be utilized in practice?
Thanks. So I would say, Barbara, feel free to comment on the question that just came in, or Beth's, and then we'll conclude.
Thank you. I think the questions are, what my answer is related to both questions. So it is a universal call, which doesn't mean that all parts of, it doesn't mean that data solidarity would be implemented or be relevant exactly in the same way in every region, in every country, but because it also has this global justice dimension. And in the third pillar, which I didn't talk about, when it comes to commercial profits, then we have a massive equity problem around taxation. The fact that the digital businesses, I'm not going to go into this, sorry. I tend to go into things. So it's universal. It's really ideally something that should be used as a new model to think about and regulate data. So how could it be implemented in a hospital? A couple of things would need to be done at the national level, or even in Europe at the supranational level, to change taxation, for example. If we said, okay, we do the benefit sharing via different types of taxation for digital businesses, or even a data tax, that would need to be done by national government. It's not something a hospital can do. But other things can be done by hospitals. So the hospitals could do public value assessments. In some cases, around secondary uses of data, deciding who they share data with, to see, to prioritize, for example, those users that have high public value scores. They could also set up, maybe not at the level of an individual hospital, but definitely at a group of hospitals or at the provincial level, a harm mitigation body. So I haven't talked about this much, but harm mitigation bodies are bodies that people can appeal to if they feel that there's something going on the basis of data use that's harming them. So there are lots of things in the data solidarity suite of policy instruments that institutions can do. And we did publish a white paper in 2022 that lists some examples of those, and there will be a new version of the white paper probably next year that will have a more comprehensive list of what different institutions can do. So it applies to at all levels of policy making, not only public policy making, but policy making.
Just come here to advance our slide and make a few sort of final closing comments. Of course, huge thanks to our speakers and respondents for today. Obviously, this is an urgent issue that many people are investing time and energy in coming to understand, and I think this has been really important opportunity to bring together a number of really important themes on the topic and hear from a few people leading thinking and practice on the topic. Just a couple of comments in relation to the TCARM, Temerity Center for AI Research in Education and Medicine, is working to build a community. So if you'd like to learn more about them and join their effort, please do so. The Joint Center for Bioethics also has an ongoing seminar series, and there's lots of opportunities to engage with us as well. So please reach out to the email address here if you'd like to learn more. And here we have a QR code to an evaluation for this session. So please take a photo and navigate to the evaluation and let us know what you thought. And with that, again, Sophie, Beth, and Barbara, thank you so much.